We've all seen the demand for thread vein treatment, microsclerotherapy, surge. But for us as healthcare professionals and clinic owners, the real challenge is not only technique, but also regulatory compliance. Many practitioners are confused about who can legally perform this procedure. As someone who has operated under CQC regulation and understands the clinical risk, I'm here to clarify the essential legal and professional framework you must follow and adhere to. This is about clinical governance, not just aesthetics. Today we're breaking down the critical difference between prescribing and administering the sclerosing agent. We'll also define the CQC's line in the sand, a distinction that can determine your entire regulatory burden. Let's start with the central issue, the drug itself. Microsclerotherapy is an injection procedure using a sclerosant. In the UK, the two product licensed sclerosants, Polidocanol, Aethoxysklerol, and Sodium Tetradecyl Sulfate, Fibrovein, are strictly prescription-only medicines, or POMs. This fact immediately restricts the role of any unregulated or non-prescribing practitioner. The law requires that a POM is prescribed by a legally qualified and registered independent prescriber. This means a GMC registered doctor, an NMC registered nurse, independent prescriber, V300, or a GPhC registered pharmacist, independent prescriber. Furthermore, in the current regulatory climates, bodies like the GMC and the NMC are tightening oversight. We must operate with robust governance, and that starts with the prescriber personally undertaking a face-to-face clinical assessment before issuing the prescription, in line with updated professional guidance for aesthetic POMs. This is where clear clinical governance becomes crucial for your clinic structure. Only registered prescribers can prescribe the sclerosant agents. However, under UK law, the administration of that prescribed medicine can be delegated. A suitably trained and competent healthcare professional, for example a registered nurse even without a V300 qualification, or an aesthetician, can administer the POM under the direction of the prescriber. The key term here is a patient-specific direction, or PSD. This is not a blanket protocol, it's a written instruction for a named patient signed by the prescriber. The non-prescribing administering person must be able to demonstrate documented training and competence in microsclerotherapy, clear clinical supervision by the prescriber, robust protocols for managing all complications, including anaphylaxis, with the prescriber taking ultimate clinical responsibility for the patient's journey. Now let's address the elephant in the room for compliance, the Care Quality Commission, CQC. Do you need CQC registration for microsclerotherapy? The answer lies in the intent of the procedure. The CQC regulates activities under the Health and Social Care Act 2008, specifically the treatment of disease, disorder or injury, TDDI. If you are treating someone with signs or symptoms of venous disease, such as ache, throbbing, varicose veins or varicose eczema, that person has a medical condition and needs a duplex scan. Then you're engaging in TDDI and the CQC registration is required. However, if you're treating only cosmetic spider veins of the leg with no associated symptoms or signs and a negative Doppler screening test, This specific activity is exempt by law from CQC registration. While many vein specialists operate under CQC registration to demonstrate the highest level of governance across all services, understand that the legal requirement hinges on the cosmetic versus medical distinction. Your legal and professional safety is determined by adhering to these rules. Prescribing. Only a qualified independent prescriber can prescribe Polidocanol or STS, the 2 UK licensed sclerosants. Administration. Suitably trained and competent practitioners can administer the POM under a patient-specific direction and clinical supervision. CQC. While CQC registration is not legally required for the purely cosmetic treatment of spider veins, operating with CQC level governance is the best way to safeguard your patients, your practice, and your indemnity. Treat this with the seriousness it deserves. Your professional registration might just depend on it. I hope now you have clarity on who can prescribe sclerosants, who can perform microsclerotherapy by administering the sclerosant, and who requires CQC registration. I've put links to the important regulatory information in the box below. Please like and share this video, it really helps spread the word about microsclerotherapy, and be sure to subscribe. That way you won't miss my next video. Leave a comment and I'll get back to you as soon as I can. Thank you for watching.